this happens all the time. People start to experience the treatment, then they look at the device as you're treating, and they're thinking to themselves, session after session, wow, wouldn't it be great if I could get this relief at home? Before long, either the patient has asked you directly about getting their own machine, or maybe they've even started looking around online and seen that they can, in fact, purchase these for home use. Hello, everyone, and welcome back to another Sana Institute 10-minute training. Today, we're talking about a topic that is a little bit challenging for a lot of practitioners, especially when they're getting started with microcurrent therapy, which is, what do you do when a patient of yours decides they want their own microcurrent device? It's kind of like a tale as old as time. In a way, like this happens all the time. People start to experience the treatment, then they look at the device as you're treating, and they're thinking to themselves, session after session, wow, wouldn't it be great if I could get this relief at home? Before long, either the patient has asked you directly about getting their own machine, or maybe they've even started looking around online and seen that they can, in fact, purchase these for home use. This kind of leaves the practitioner sitting in a little bit of what can feel like an awkward position, because on the one hand, you're feeling like you're going to lose a client, and on the other hand, you want to make sure you help your client out. And you're in this position where you can't really even just turn around to them and say, no, look, sorry, you can't buy them, because of course they can look and they can figure these things out, and then this comes across badly on you. But the truth of the matter is that no matter how many times I've seen patients do this, they always kind of come back full circle. Practitioners offer stuff that clients simply can't do to themselves. Bigger protocols such as 3 pathways, advanced protocols such as chakras. Are you going to come across the occasional client that doesn't care about costs and is willing to buy a pinnacle device and all of the accessories just so that they can work on themselves with these things at home? Yes, but they're still going to be limited in certain protocols. As I mentioned, things like 3 pathways, the gynecological protocol, the abdominal protocol, these are all really challenging to do on yourself. And these are some of the big things that you would do in a clinical setting. So what's the answer? The best option, truly, is to guide them on that journey to getting their own device. But realize that you can also guide them into the more basic, easy-to-use machines. Very rarely are we going to find practitioners that themselves are using the Genesis 2, for example, or even the new Avasia Blue bundle that we have. But maybe this is perfect for the patient. It gives them something basic that they can do at home, but it doesn't take away the advanced features of the other devices that you can have as well. And again, keep in mind that in order to pull off some of these things, even like the Gamma Energizer protocol, which can help with dementia and Alzheimer's, the investment to get the right tools and the right device for that it's going to be running you, what is that, close to $4,000 by itself. Most patients aren't going to invest that. And if they do, the other point of the matter is that typically this just leads to more revenue for you. These patients become raving fans, they start to use the device themselves, and they send more clients your way in the form of family members and friends. The challenge can certainly seem like it's going to shrink your practice when in actuality it grows it. Beyond this, we have many programs that enable you to refer or purchase wholesale products. So by building in the option of getting their own device, you can ultimately expand your revenue and business that way as well, by becoming a distributor or by simply referring your clients to get the device and then seeing that they will continue to come back, because that's what we do see. This is where, again, someone's going to rely on you to give them the guidance that they need. They're going to be able to, as well, get more enhanced results, because what you're doing in the clinic can be led into their home as well. You can say, hey, so why don't you use your device to work on this area of your ankle tonight and see if that helps to alleviate the pain? Just do this and show them what to do. And then they can almost continue the therapy in absence of you, But that also drives those results. It means that when they come back next week to see you again, it's going to be easier for you to get the results that you're looking for with them. So in the end, the answer to the question of what to do when a patient needs or wants to get their own microcurrent device is to kind of just roll with the punches. It's going to be an individual process, but in the end, I think the best thing to do is to embrace it and help the clients get the device that's going to best suit their needs, but also their capabilities. Because bearing in mind that the Blue has 2 modes, the Genesis 2 has 4, but maybe the Evolution's 8 is too complex. Certainly for many, the 71 programs in the Pinnacle is going to be a bit too much. Or at the very least, it's just way more than the client needs. But if you can provide that extra guidance at home, we're truly helping them to take back control of their bodies and of their health. And trust me when I say they will continue to use you as a practitioner. It's not going to lose you patients. It's only going to enhance the results that you get. So hopefully that alleviates some of the concerns that people might experience with this question and kind of encourages you to know that there are options out there. Like you can utilize this to build your business. And honestly, this is one way that a lot of practitioners do this, is to start referring people and start collecting additional revenue, but knowing that they're going to continue to see them for other things. And especially as you become a certified pain resolution specialist here at the Sana Institute, you get certified in nutrition, in fitness, in stress reduction. So you can end up incorporating supplements, exercises, and other things too that they're simply not going to have the knowledge. So there's going to be that continued building balance. Lastly, I'll say that in some cases, there needs to be a at-home treatment option. Patients that, for example, desperately want to treat their eyes. If you're not an eye doctor, it's an off-label treatment, meaning that you probably shouldn't be doing it in your clinic. But there's nothing saying that they can't opt to do that themselves. So there are a lot of options there as well that can help others beyond the capacity and scope of the clinic. All right, so hopefully you found this information useful. If you have any questions about this process, or if you've got any concerns, or if you'd like to hear anything else about it and have any more questions about this topic answered, please drop them in the comments below, and I will take a look at them and see what it is that I can do to help assuage your concerns. Thank you, everyone, for joining me today. I'm Dr. Rob Vanbergen, and I'll see you next week for another 10-minute training. Take care.